Hey everyone, welcome back to the channel. Today we're talking about something that sounds dramatic but is actually very important to understand properly. Doctors are warning men about a very common food that, when eaten regularly and in excess, may slowly contribute to prostate irritation and worsening urinary symptoms over time. Not overnight, not instantly, but quietly, in a way most men never connect to their prostate health. Now let me be very clear from the beginning. This is not about banning a food, it's not about fear, and it's definitely not about blaming one thing for all prostate problems. Prostate health is complex, but certain foods can increase inflammation, worsen urinary symptoms, and aggravate conditions like benign prostate enlargement, especially when they're eaten frequently. And the reason this matters is because many men come to me and say, "I'm doing everything right. I take supplements, I drink water. I try to stay active, but my symptoms keep getting worse." And when we really break things down, diet often plays a much bigger role than they expect. So let's talk about the food that keeps coming up in research, clinical conversations, and real patient experiences. And that food is processed red meat. Now, before anyone gets defensive, let's slow this down. This is not about never eating red meat again. This is about understanding how often, how much, and how it's prepared. Because the issue isn't a steak once in a while. The issue is frequent consumption of highly processed meats like sausages, hot dogs, deli meats, bacon, and packaged meat products. So why are doctors concerned about these foods when it comes to prostate health? Let's break it down simply. Processed meats are associated with higher levels of chronic inflammation in the body. Inflammation doesn't just affect joints or the heart, it affects every tissue including the prostate. The prostate is a very sensitive gland. When it's exposed to long-term inflammatory signals, it can become swollen, irritated, and more reactive. Many men with prostate enlargement or urinary symptoms already have a baseline level of inflammation. Adding more through diet can make symptoms worse over time. This doesn't mean you eat bacon once and suddenly have prostate problems. It means repeated exposure, week after week, year after year, can slowly contribute to changes you don't notice until symptoms become disruptive. Another issue with processed meats is how they're preserved. Many contain nitrates and nitrites. These compounds can form substances in the body that promote oxidative stress. Oxidative stress damages cells and interferes with normal tissue function. Again, this is a slow process, but the prostate is particularly vulnerable because of its hormonal environment and blood supply. There's also the issue of saturated fat. Diets high in saturated fat are linked to increased inflammation and hormonal changes. The prostate is hormone sensitive. When dietary patterns push hormone levels in an unfavorable direction, prostate tissue can respond by growing or becoming more reactive. That can translate into urinary frequency, urgency, weaker stream, or nighttime bathroom trips. Now let's talk about something men often don't connect: digestion and pelvic pressure. Heavy, fatty meals, especially late in the day, slow digestion. This can cause bloating and increased abdominal pressure. And that pressure doesn't go upward. It goes downward toward the bladder and prostate. Many men notice their symptoms are worse at night after a heavy dinner. That's not a coincidence. Another overlooked factor is sodium. Processed meats are often very high in salt. Excess sodium can irritate the bladder and increase urinary urgency. When the bladder is irritated, the prostate often feels the effects. The bladder and prostate sit right next to each other. When one is unhappy, the other usually is too. Now here's the part that's important to understand. This doesn't mean processed meat is the only problem. It means it is one of the most common contributors because it is eaten so frequently and often without awareness. It's easy, it's convenient, it's everywhere. And because the effects are slow, people don't connect the dots. So what do doctors actually recommend? Not elimination, reduction and balance. Men who shift toward a more prostate-friendly diet often notice gradual improvements in symptoms. This includes emphasizing foods with anti-inflammatory properties. Think vegetables, fruits, whole grains, legumes, fish, nuts, seeds, and healthy fats. These foods help counterbalance inflammation and support overall pelvic health. Tomatoes, for example, contain lycopene, an antioxidant that's been studied for its role in prostate health. Leafy greens support circulation and reduce oxidative stress. Omega-3 fatty acids from fish may help balance inflammatory pathways. Fiber improves digestion, which reduces pelvic pressure and bloating. Another key piece is timing. Even if you choose to eat red meat, having it earlier in the day rather than late at night can make a difference. Your body has more time to digest it, less pressure builds up overnight, sleep improves, and better sleep supports hormone balance and tissue repair. Now let's talk about portion size. In many diets, portions of meat are much larger than necessary. You don't need a plate dominated by meat, using meat as a side rather than the main. Focus can significantly reduce inflammatory load without feeling restrictive. Something else that matters is how the meat is cooked. High-temperature cooking like grilling or frying can produce compounds that increase oxidative stress. Choosing gentler cooking methods like baking, steaming, or slow cooking can reduce this effect. Now I want to address a common question I hear. If processed meat is so bad, why don't I feel symptoms right away? And the answer is because prostate changes are gradual. The prostate enlarges slowly, inflammation builds quietly, symptoms creep in over years. That's why prevention and early lifestyle changes matter so much. Another important factor is consistency. A single healthy meal won't undo years of habits, but consistent small changes can absolutely support better prostate comfort over time. Men who reduce processed foods, improve hydration timing, manage stress, and stay active often report fewer nighttime bathroom trips and better urinary flow. Stress is another piece of the puzzle. Diet and stress work together. Stress hormones increase inflammation and tighten pelvic muscles. If your diet already promotes inflammation, stress amplifies it. That's why addressing both matters. Let's also clear up an important misconception. No single food causes prostate disease, and no single food fixes it. Prostate health is influenced by genetics, age, hormones, lifestyle, and overall health. Diet is one piece, but it is a powerful piece because it is something you control every day. Now, if you're watching this and thinking, I eat processed meat often and I'm fine, that may be true right now. But prevention is about what happens 5, 10, 15 years down the line. The goal isn't fear, the goal is awareness. And if you already have symptoms, frequent urination, urgency, weak stream, waking up at night, dietary changes can be a helpful part of symptom management alongside medical care. They're not a replacement for seeing a doctor, especially if symptoms are severe, sudden, or worsening. If you notice blood in urine, pain, fever, or sudden changes in urinary habits, you should seek medical evaluation immediately. Lifestyle changes are supportive, not diagnostic tools. So what's the takeaway? Doctors aren't saying one food destroys prostate health overnight. They're saying that frequent consumption of processed meats may quietly worsen inflammation and urinary symptoms over time. Reducing intake, improving balance, and making thoughtful choices can support better long-term prostate comfort. Your prostate works for you. Every day, supporting it doesn't require extreme measures. It requires consistent, informed choices. If you found this video helpful, give it a like, share it with someone who needs to hear it, and subscribe for more science-based men's health education. Taking care of your health is one of the smartest investments you can make. I'll see you in the next video.